My name is Marie Molde with Datassential, and today's interview is on food safety in the times of coronavirus and COVID-19. Our guest is Mary Angela Miller, the food safety dietitian. Mary Angela is on faculty at The Ohio State University, and she also maintains a website, keepsafefood.com, to help consumers understand how we can best navigate these waters and keep our food and ourselves healthy during these times.
I think this is a great opportunity for consumers to become educated about food safety overall. All right, we could use this COVID-19 situation kind of as a learning experiment. And the reason I say that is so many times, I work a lot with consumers right now, and I hear their questions, and they don't understand the difference between spoiled food and unsafe food. And they think they know what's unsafe because they can smell it, or they can taste it.
Yeah.
And what coronavirus has shown us is that something can be unsafe that you can't see or smell. And so now they are worried about it. So even though you don't get it perhaps in your food, it's really heightened the concern about, well, what if somebody's touching my food or opening my food? The whole parts of food safety with cross-contamination and personal hygiene. So I really think that we can use this as a learning experiment or a learning opportunity so that people understand about food safety better. And that if we all follow food safety better, whether at our restaurants or bringing it to our homes or in our homes, how it can be safe. Certainly safe, if not safer in the future with what we're learning about and practicing today.
And Mary, do you think all of these new policies, like I think just yesterday or the day prior, the FDA released sort of a best practices checklist where they're recommending things like masks in restaurants or even plexiglass shields at the checkout or even kind of infrared temperatures of employees before they start their shift? Do you think all of this is something we should have maybe even thought of before COVID happened? And maybe would you see it as beneficial if any of these practices continued on after we're out of kind of the thick of things?
It's certainly been confusing, hasn't it? Because
Yeah.
especially the mask issue with all the different conflicting information that we've heard over time. One of the things that, going back to my history, right? I worked in a healthcare center, the Ohio State University Medical Center, high risk patients, hard working staff. So to me, anything that protects the worker, especially the service level worker, is worthwhile. So I'm almost interested in those measures, not just for our restaurants and our customers, but for the person, on the other side, if it can help them as well. So maybe we didn't know enough to do it before, but I think some of those will continue and that'll be fine. Our challenge will be to keep the personal connection, because that's what I worry about losing, especially when it comes to food.
Would you say that the food supply in our country is safe right now, whether it's at grocery stores or restaurants?
I have certainly done a lot of listening, reading, pulling up every report I can find on that really on a daily basis. And I'm comfortable with the food supply right now. And that's what I tell my friends, that's what I tell my family, and that's what I tell the people who, follow me on Facebook or check out the website. Certainly we can all play a role in that, in keeping it safe for our circle, our small circle. But everything that I've seen, we're doing the right things to make that safe right now. So I'm comfortable with it based on what I know and what I've done and what I'm hearing every day. That would be my opinion.
We find in our data that consumers are very freaked out right now about kind of this notion of touch and touching shared objects. At the grocery store, if someone had touched their package before them, or with their delivery restaurant food, they know someone has touched the packaging. So people are sanitizing things once they get home. Do you think that's a good best practice for us to be using right now, whether it's sanitizing our food packages themselves or getting rid of our bags right away?
I don't think it's harmful to do that. I'm not sure it's the most important thing that consumers should be doing.
Yeah.
But again, if they weren't sanitizing, it's not as important to say washing your hands before and after, correct? I mean, we all know that that's the most important piece of it. So I've seen some crazy things about leaving your food in the garage, for a couple of days.
Yeah.
I'm a food safety expert. No, I would not recommend that. And I don't see there's a benefit to that. So I think it doesn't hurt to do it, but I'm not sure that it's the most important thing to do. I worry more, I'll be honest with you, about what people do in their own homes and who else they might be exposed to, because, the restaurants that we're working with, they have food safety training. There's even extra food safety training these days. I listened to both the new 10, 11-minute Serve Safe food safety trainings. The one for the people who transport food, that was pretty good. It would give
Yeah.
some great basic tips. But the person at home isn't doing any of that or might not know any of that.
Hmm.
I say there's almost a theme songs for this. So for the whole pickup and delivery, it's like life in the fast lane. Okay, let's
Yeah.
get it there quick. Let's get it there. But I'm more worried about what happens with Charlie Rich behind closed doors. So once we get it to you and the supply chain and the restaurants, they've all done their food safety thing. What are you doing behind closed doors to keep your food safe? And that's the piece I think that we want to make sure we don't forget once it gets in your home. You
Yeah.
know, well, how are you handling it once it gets in your home? How long is it sitting there? Does it need warmed up? Do you know how to warm it up?
Hmm.
What can you do? If you ordered a big meal, like I said, we every weekend we're trying to do two different things. One night get takeout, and the other night cook. Now
Yeah.
that's a fun experiment. If you have two people trying to take turns cooking in each other's kitchen,
Yeah, I bet.
we've learned a lot. But I really think that we have to think more about not just about when it gets to your door, but what do you do with it when it gets beyond your door? And restaurants can help us with that.
It sounds like, would you say hand washing is like the single most important thing when we get home?
We've always known that, right? The hand washing is the single most important thing. And when I come in from the grocery store, because I've still found it more convenient to go than to have delivery for the few things that I need. But wash my hands before I go, wash my hands or use the sanitizer when I get to the store, and wash my hands when I get home.
Yeah.
And if I've done that, the other thing that I've done, and I've just started this week, is not wear the shoes that I wore outside into the house. Because I
Yeah.
did read one study on surfaces that said, granted it was a study in a hospital, but virtually half the floors, even though they were doing their best to keep them clean, were contaminated. So I don't want to track that in my house, and I certainly wouldn't want to try that 5-second rule at home right now.
Would you advise to actually take the temperature of reheated food?
I always say, trust your thermometer, don't trust your senses. Okay.
Okay.
How do we know? How do we
Yeah.
know? But the thing that I've learned is that most people, or many people, don't have the right tools at home. They don't have a thermometer at home. Even if they do, it might not be one that's an easy one to use, and they've never done it.
Hmm.
I'll just tell you one of the things that I did, because I was researching thermometers. I have a food safety kit that I use for consumers.
Uh-huh.
So I was getting all these thermometers in and sampling them. And I gave one to my son-in-law and I gave one to my guy friend. All right. And they both kind of did this, rolled their eyes. Thank you, Mary. They don't want a thermometer, right?
Right.
But then I got some more in and I had to test them again. And so I had to get those back. And when because I wanted to test them all against each other to see which one I was really going to recommend. And both of them came back to me after 2 or 3 weeks and said, do you still have my thermometer? I need that thermometer back. Because
Uh,
when you use the right kind of thermometer and it's easy to use and it's a quick read, then you're not going to go back to not using one, especially if you're cooking foods or preparing foods for somebody that you care about.
yeah. And what I find a little bit complicated is it seems like every type of food has its own temperature it needs to reach. Is there like a number we can say, if my food reaches 170, I'm good? Or do we need to know all the specifics?
Well, you should know the specifics, but how many people, Maria, really do?
Right.
So, one of the things that I try and communicate is if you really want people to practice food safety, you have to have what they need to know, right, when and where they need to know it. One of the things that I did when I was trying to come up with ways to help consumers keep food safe at home, I came up with chopping mats that have the temperatures right on them, right? So
Oh,
it's
wow.
right in front of you. But when I was testing them, and this one was actually, it's called Food Safety FAQs for first time foodies or people in dorm rooms, people who've never really cooked before with their commonly asked questions. My nephew asked me, and he was living at the time in an off-campus house with a bunch of guys. He goes, Aunt Mary, what are those numbers on there? I go, Brad, those are the numbers that you cook the food to. It's a safe food temperature grid. He goes, well, you need to put that on there. And I didn't even think of it.
Oh,
They'll put on there, cook foods until they reach this temperature. And then it's right on your guide and you don't have to go look.
yeah.
And that's something that I think restaurants can help us do too. Think of the basic thing when you're at a restaurant, right? You should label that food and date that food.
Yeah.
Why not
As
send
far
it?
as delivery food, do you mean?
I
Or
think they should send that home with the label and the date. That way, if you're putting, when I open my refrigerator today and I have 2 or 3 takeout things that I had this weekend, I know the date that I got them and I know what's in them.
Mhm.
So just the basics that we practice at a restaurant, we could make that an option for people at home and make it easier. If I had to give you one temperature though, I would say, again, reheating skills, reheat to 165 for 1 minute,
Okay.
and to give people some basic instructions how to do that. And don't assume they have a thermometer. Don't assume, most people have a microwave, but not everybody does. And don't assume they know how to do it,
Yeah.
because they don't. They don't. They've not had training. How would they know?
Yeah. We're all getting more takeout food now, so I think it would be helpful for a lot of people to have the date of the food on it. Do you have any best practice kind of timing concept of how long delivery food is good for? I guess that's very variable too, depending on the type of food. But if you order something on Tuesday, is it good till Friday kind of a thing?
Yes, there are certainly some general guidelines for that. So you have to consider your transit time. But in general, the first thing is 2 hours at room temperature max.
Hmm.
So if you get home, you have to count that time if it's had a long delivery time and if maybe you're not ready to eat it right away. Okay. So that before you refrigerate it or else you heat it back up. Once it's in your fridge, there's a quality issue and then there's a safety issue. But in general, there's a 4-day throwaway rule.
Okay,
So
4-day throwaway.
and again, I try to keep it simple for people who aren't going to who aren't going to go and look up each individual food. And I've kept food longer than that, but I make sure that when I reheat it, I do it safely and to the right temperature. But in general, if all else, you don't know, 4-day throwaway. And that's why it'd be nice if I had the date right on there. So you don't have to sit there and calculate in your head, oh, that was 4 days ago. This might not be the best thing to eat today. Is there something that's fresher?
Yeah, okay, 4-day throwaway. That's helpful.
Great.
Mary, can you share with us a bit about what's on your website, keepfoodsafe.com, what consumers might find there?
What I try and do is to make it easy for consumers to keep safe food.
Okay.
And the reason I say that is, you're a dietitian, I'm a dietitian, we work in the food industry, we know a lot about food safety. But the average person at home doesn't know a lot about food safety, and they make a lot of assumptions. And there's great information out there from the CDC, from the FDA, from university extensions. But it's geared to people like you and me, and not everybody eats like you and me. So people need simple guidelines that are most important so that they can keep safe food at home. And that's what I try and do. I try and give them information that's practical, that's written in a language that they use it, or like I said, we talk about leftovers because many people cook from scratch, but many more don't. All right.
Hmm.
And that makes it kind of fun and kind of irreverent. So, for example, one of the things that I just shared was I was using this sanitizer that I got as a health fair giveaway.
Uh-huh.
And I used it for a couple of days. It was a little spray one that I could keep in my purse. And I'm like, this feels weird. This feels weird. Pull it out. It looks exactly like another hand sanitizer. It was sunscreen from a
Oh,
can of
wow.
health food. So just make sure you know what you're doing. It probably wasn't harmful to put it on my hands, but I certainly wasn't sanitizing it. So just simple things. Do you need shoe covers? Somebody asked when I talked about the amount of COVID that we found on floors. Well, no, maybe you don't need to go out and start a run on shoe covers, but take your shoes off at the door or wear your slippers inside. So those are the kind of things that I try and help people, just simple tips to keep safe food at home. And then I have a food safety kit too that has like the basics for clean, separate, cook, chill.
Mhm.
Um, if you wanted to do like a gift for somebody to help them keep safe food at home.
That's great. Have you
Right.
noticed how restaurants are doing those sort of family meal bundles now with like takeout for four people? Uh, I would think that those might be more likely to have leftovers from. And I'm thinking about the date you shared, or having these tips at home to know how to best consume all of that food would be very valuable.
I agree with you, and I love the takeout and bundled meals. And I know my daughter's family's using those a lot
Yeah.
because even though they're home and they have all the equipment, she's trying to work from home, and the kids are being, schooled at home now. So they use those bundled meals a lot, and I think they're great. Here's a way that I think restaurants can help us with that. They should have tips on how to use them, how to reheat them. And you can't put a whole food safety manual in your takeout box, right?
Yeah.
But if I was a restaurant, I would have on my website, or I would have on my app, I would have a link to, if you bought this, here's the best way to keep it, here's the best way to reheat it, both from a quality and a safety standpoint. And I think that would build customer loyalty as well as help them keep safe food at home. Also, maybe add to your sales.
Yeah.
So let's say I was going to buy wings, and I'm going to buy a big one so I don't have to make a big bucket, so I don't have to make 2 trips this week. But buy one sauce for today and buy a bottle of sauce that you might be offering for later in the week, so I'm not having the same thing over and over again. So
Yeah.
yes, I have noticed that, and I think it's a great opportunity for us to expand food safety and bring people back to our websites where they can offer practical information to help people keep safe food at home.
That's great. One thing our research is clearly showing us is that consumers today are interested in this notion of overt sanitation. It's
Mm-hmm.
almost like you can't be careful enough as far as showing that you're wiping down tables, or you're using gloves or using masks. And I almost see that kind of food safety handout that might come in a delivery kit kind of as part of that. It's like we're not only thinking about your meal that you might have right now, but if you have leftovers at home, here's how to treat them.
And that's exactly what I've been trying to reach out to some of my local restaurants to help them do. I was talking to the Ohio Restaurant Association yesterday, and we were talking about beverages. And I hadn't thought about beverages, because now in Ohio, just this week, we started allowing people to take out alcoholic beverages. And Laura Morrison at the Ohio Restaurant Association says, what are you going to tell people about that, Mary? And I haven't thought about that yet. But
Hmm.
because beverages could be an issue.
Yeah.
And I not only alcoholic beverages, but other beverages, if you get the grande, and you don't drink it all right away, how should you say that? Does it have a straw in it? So we need to think about that as the rules keep changing.
Yeah.
And these are the kind of things that I'm trying to help restaurants figure out.
That's a good point. I hadn't thought much about beverages either, but I suppose the reheating is not an option there. So you have to use some other precautions.
Right. Especially if it's a beverage that you sip through a straw or you sip through the cup. So, there's just some basic things that we can do to keep those safe and
Yeah.
not leave them on your counter for the rest of the day.
So, Mary, one question I'd love your thoughts on is, in our research pre-COVID, consumers today, especially younger consumers, are concerned about our environment and climate change and sustainability of foods, and kind of protecting our planet. And so, we don't think that that underlying interest in climate change and being good stewards for our earth has necessarily changed. There's no reason to think that it has, since coronavirus has sort of become part of our lives. But a lot of what revolves around food safety, especially with restaurants today and all of this delivery and takeout food, it comes with a lot of packaging. You might have like 6 plastic bags or styrofoam containers, uh, or, all the disposables, the gloves and the masks. So, do you think sustainability and food safety are in opposition? Like, is there a way that the two can kind of harmoniously coexist?
That is an excellent question, and it's one that has troubled me. I'll be honest with you. So I would say a few things about that. One is that when we encourage people to practice food safety, one of the hooks that I use, especially when I'm talking to younger people who are, not that we all shouldn't be concerned about that, is that if you know more about food safety, you're more likely to eat your leftovers but do it safely rather than say, oh, gee, I don't know if this is safe and pitch it. So
Hmm.
by being knowledgeable about food safety and food handling, you can actually, I think, consume food rather than throw it away. The other thing to understand is that if you're handling it safely, that washing your hands, those kind of things, that you don't necessarily need to use all the plastic or you can reuse it. So
Yep.
one of the questions that I get a lot is the packaging that comes home with my food. Is it safe to reheat it in that? Can I put that in the dishwasher and use it? Can I use that food to store in my refrigerator? Or do I really just have to handle it with gloves and throw the plastic away?
Hmm.
So I think that we've talked a lot about packaging, right, in the last few weeks in the industry and how some of these things will stay. But we really have to think about plastic and there's a better way to do it. And if there's a way to reuse it, and maybe not reuse it and take it back to the restaurant and reuse it, but how do we reuse it at home? And
Hmm.
I know I've made a concerted effort to do that. So I've got a lot of my brown plastic containers. And no, they don't freeze well, but I have washed them and I've taken food over to my daughter's house with them.
Yeah.
And I've taken it over to a friend's. Or one of my friends and I were sharing berries back and forth so that we can, because I love fresh fruit. And I refuse to give it up, even though I don't want to go to the store every 3 days to get it.
Yeah.
So I'm like, don't bring it to me in a throwaway container. Use this plastic container so that we don't throw it away. So there are some small things we can do, but I think it's going to be up to the industry to come up with some more viable alternatives because I am worried that we've taken a big step backward in that during this crisis.
Yeah. Yeah. Well, that's promising that there are things we can do. And I think it seems like the industry is aware of the problem and kind of working toward solutions. And I've also heard things like, we're driving our cars less, at least during this time. Or I think the skies in China were clearer than they'd ever been post COVID. Maybe things are offsetting, but I think longer term, to your point, we'll have to think about more viable solutions for packaging and all of these disposables.
Right. I would agree with you. It's worrisome.
So Mary, we heard in beginning our research, which we started around the 10th of March, you know, concern about food safety was really high at first and only growing. And now it's really sort of leveled off. So we think that people are kind of learning about best practices and starting to kind of understand our solution and how we should handle ourselves. And, um, you know, regarding food delivery or food at the grocery store, people think optimistically, 60% of people think that within 3 months, it's going to be safe to dine in restaurants again. Does that sound realistic to you?
Well, I've seen so many models, okay, and in every state we have our different model because have different incidences. I really hope so,
Hmm.
but I don't know so.
Yeah.
I really hope so, but I don't know so. So I would have to just kind of say I don't think we really know yet. Um, and I'm really worried about that first regathering of people and what might happen after that once we let our guards down. Um, I will say that prior to COVID, you asked about COVID and what's going to happen in 3 months when we go, hopefully we're able to go back to dine in restaurants.
Yep.
The CDC said one of the most preventable public health problems is foodborne illness. So now, of course, there's another public health crisis, which we're much more preoccupied with. But what I hope is one of our outcomes from this whole process is that the other causes of foodborne illness will be reduced because of the things that we are learning right now and practicing right now and educating the consumer on right now. And I think restaurants are doing a good job and are almost the primary way we're doing that. That might help us solve this problem in the future post COVID-19.
Yeah.
And if that's in 3 months, great. But what do we learn from the past pandemics? Is that there's at least one more wave and probably not a third. And a lot will depend on what we find out in terms of antibody testing and vaccines over the next, 12 to 18 months. So I'm hopeful, but I think 3 months would be wishful thinking right now.
Well, that is promising. That's very optimistic what you mentioned about how food safety is a problem. It has been a problem, and it is preventable. So what we learned during this pandemic might help us decrease, sicknesses or deaths from food safety moving forward. And I guess that's quite a nice silver lining.
Right, because there's so many other causes of foodborne illness, and many of them are bacterial, and some of them are viral. So everything that we're doing now to prevent viral transmission, all of those habits are great habits, and they will carry over into the new normal whenever that is.
Great. Well, Mary, this has been really fantastic. Thank you very much for your insights. Is there anything we have not covered that you might want to share with the audience regarding the outlook um, of food safety and in our food supply or at restaurants?
The one thing that I would want to share is for those of us who work with consumers on food safety, the information that is out there is great, credible. You and I are dietitians, evidence-based information, but it's not communicated in a way that the everyday person eats or cooks, because not everybody has those skills. So that we should really, really take an effort to make food safety fun and simple, to
Mhm.
make it easy. I always say for people to protect their plates. And restaurants can certainly help with that right now. And we have an opportunity to use the knowledge that we have on food safeties in restaurant and retail organizations to help our consumers keep safe food at home.
Yes, that's the goal, right? I like that. Protect your plate.
Yes, that's my tagline, protect your plate.
Okay, excellent. Well, thank you so much, Mary.
Okay, have a good one.
You too.
Stay safe.
Thank you to Hal and Mary Angela. These insights have been so valuable to the industry and to consumers at home, helping understand how we can best keep safe regarding our food choices during this time of COVID-19. So thank you very much for being with us.